Hi BCS families, my name is Jennifer Mattingly and I'm the district nurse for Bardstown City Schools and also the school nurse for the Bardstown Elementary, Middle, and High School. I work with the Healthy Kids Clinic to create a healthy environment here at BCS and to provide extended health services for students and staff. Today I want to talk about how we can keep our children and community healthy so that schools can remain open. Preventing the spread of COVID-19 amongst our families and community is crucial to keeping school physically open. One of the best ways to do this is to keep children who are sick at home. When you do this, you're protecting your family and our community. You should keep your child home if they display any of the COVID-19 symptoms. Signs and symptoms of COVID-19 are a temperature greater than 100.4 degrees without fever-reducing medication, a new uncontrolled cough that causes difficulty breathing, a new rash, vomiting, diarrhea within the last 24 hours. If your child displays any of these symptoms, contact your healthcare provider. Also, if your child has been exposed to a COVID-19 case during a 48-hour period, keep them home and contact the local health department for more detailed guidance. Other reasons to keep your child home from school include flu-like symptoms, head lice, eye redness with green drainage, or a contagious illness such as strep. It is equally important to keep your child home until they are no longer contagious. So how do you know when your child is ready to return to school? That depends on what illness or symptoms your child had. If your child was experiencing COVID-19 symptoms or had exposure to COVID-19, they can return to school once they have been fever-free for 24 hours and their symptoms have improved and it has been 10 days since their symptoms first appeared. If your child tested positive for COVID with no symptoms, they may return 10 days after their positive test result, unless they start experiencing symptoms. If symptoms occur, please refer to the previously mentioned guidelines for school return. The local health department will give you guidance on when it is safe to return as well. If your child was diagnosed with an infectious disease that is not COVID-19 related, such as strep, flu, or pink eye, they can return to school once they have been fever-free for 24 hours with no fever-reducing medications and have received the prescribed medication for 24 hours. Your child should also have no vomiting or diarrhea for 24 hours before returning to school. I understand that many families may be anxious about returning to school. Your school nurses are here to help alleviate any anxiety you may have. If you have questions, please feel free to contact them. If your child is in grades preschool to 2nd grade, contact Nancy Brown. If your child is in grades 3 through 12, contact me. I look forward to working with you to keep your child healthy this school year.